Hi, Becca Monjovi again, here with my reading reflection, week number 6, second to last. Okay, so for the question number 1, components of mental status exam, I would look at appearance. I would simply look at the client. Are they dressed appropriately? Are they adequately groomed? Does their hygiene appear to be adequate? Do they appear fatigued, alert? Those kinds of things. Orientation. I want a person to be oriented to person, place, time, and purpose. So I would ask them to identify who they are. I would ask them general questions like how they got there, why they're there, ask them where we are. I would ask them maybe something along the lines of what meal will you be eating after this, or what meal did you eat before this, to try to get an idea of if they know what time of day it is. For memory, I typically like to ask clients to to name as many presidents as they can, starting with the present and going back. I have to adapt this for younger kids. And then I also ask them to remember a list of 3 to 5 items that a few minutes later they have to repeat back to me. For their intellectual functioning, I usually use a few simple math problems that I do keep appropriate to the age. Mood, I usually ask, how's your mood today? And I go based on what they say and then also based on how they seem. And affect, I listen how their voice sounds. Does it match their mood? Does it match the subjects that we're talking about? And then suicidality and homicidality, generally I just ask if they have intent to harm themselves or others. Then if necessary, I would perform a suicide risk assessment. And then I would say on a scale of 1 to 10, just discussing suicide, I'm probably in the middle, maybe 5 to 7, because I think it depends on the client. As far as conducting a suicide risk assessment, I have done it, but I would say I'm not very comfortable. So maybe like a 3. 3 things I could do to make myself more comfortable. One would probably be talking with my supervisor, going over strategies. Another would be maybe just practicing with myself in the mirror, just saying the words out loud, just so when it comes time, it's easier to get them out as opposed to feeling so awkward. And then probably doing my own counseling with my own therapist to work out any issues I have just talking about suicide. If a client walked into my office and said they were hopeless and didn't want to live anymore, I would want to get them to stay with me, and I would call law enforcement officers or guardian, depending on the age of the client. And then each letter in is path warm. For these are the risk factors for suicide. So we have suicidal ideation is I, substance abuse is S, purposefulness is P, anger is A, trapped is T, hopelessness is H, withdrawing is W, anxiety is A, recklessness is R, and mood change is M. So then 3 elements to a mental disorder. So there has to be a disturbance in the person's thinking, emotion regulation, and or behavior that is clinically significant, and it has to reflect a dysfunction in the psychological or physiological or developmental processes that underlie the mental functioning. It also has to cause a significant amount of distress in social, occupational, or other important activities, and it cannot be merely acceptable for a cultural, for certain cultural backgrounds, or as a response to a common stressor. Like if someone's lost a loved one and they're feeling depressed, that's not necessarily a mental illness. That is a grief. That's a response to their loss. So they, counseling and potentially medication could help them, but we still would not label them as having a mental illness. Okay, so I think that is all the questions. Thank you for watching. Have a great night.